Today I am going to discuss with you about epilepsy syndromes. So, what is the difference between epilepsy and epilepsy syndrome? As discussed, epilepsy is a neurological disorder characterized by recurrent and unprovoked seizures, whereas epilepsy syndromes are specific groups of epilepsy disorders with distinct clinical features. This includes the types of seizure, age of onset, and common underlying causes or mechanisms. So, epilepsy syndromes are some specific groups of epilepsies. They have got certain clinical features, age of onset, and mechanism all are common. The important epilepsy syndromes that you should know are: one is juvenile myoclonic epilepsy, second, Lennox-Gastaut syndrome, and third, very important, mesial temporal lobe epilepsy syndrome. So, this is little different from the seizure types. In epilepsy syndromes, there are distinct clinical features of different types of seizures. First, we take about juvenile myoclonic epilepsy. It is a generalized seizure disorder. It typically appears in early adolescence. Its characteristic feature is bilateral myoclonic jerks. Myoclonic jerk is a sudden jerky movement like this, which can be single one or repetitive one. Usually it occurs upon awakening, especially in the morning. Many patients have, in addition to this, generalized tonic-clonic seizures, and sometimes they can have absent seizures also. Consciousness is typically preserved during myoclonic seizures unless it is very severe. So, this is the about juvenile myoclonic seizure. Exact mechanism is not known, but often family history of epilepsy suggests that there is a genetic component is there. And genetic studies have shown polygenic causes. Now we go on to the next one, the Lennox-Gastaut syndrome. It primarily affects children. Triad of features are there. One is multiple type of seizures. This includes generalized tonic-clonic, atonic, and atypical absences. So, multiple types of seizure. Abnormal EEG finding, slow spike and wave discharges. In addition, they have got other abnormalities also in the EEG and impaired cognitive function in most cases. So, the triad of findings in Lennox-Gastaut syndrome are multiple types of seizure, abnormal EEG, that is slow spike and wave discharges, and impaired cognitive function. So, this occurs patients with, or the patients have got impaired higher mental functions. The cause of Lennox-Gastaut syndrome are various. It may be due to mutations, developmental abnormalities, or perinatal hypoxia, ischemia, trauma, infection, and other lesions. Multifactorial in condition and is thought to result from diffuse neuronal dysfunction in the brain. So, these two are generalized epilepsy syndromes. Now we come to the most important one, the mesial temporal lobe epilepsy or MTLE syndrome. MTLE is the most common syndrome associated with the focal seizures, and these focal seizures are accompanied by impairment of consciousness. We have divided the focal seizures into focal seizures with preserved or with awareness and impaired awareness. Here there is a impaired awareness. It is a distinct entity from generalized epilepsy syndromes. So it is not a generalized one, it is a focal one. It has characteristic clinical features, EEG abnormalities, and pathological features. A high resolution magnetic resonance can reveal hippocampal sclerosis, and this is the crucial part in the pathophysiology of MTLE in many patients. That is the medial sclerosis, that is the hippocampal sclerosis in MRI. Treatment of MTLE is often refractory to anticonvulsant medications, and such cases often respond very well to surgical interventions. Surgical resection of the affected mesial temporal lobe can be effective and treatment option for many patients. So thus we have covered the different types of seizures, focal, generalized, focal dividing into with awareness and impaired awareness. And then you have discussed the various types of generalized seizures and generalized epilepsy. And today we have covered the epilepsy syndromes, the three major epilepsy syndromes. Hope it was useful to you. Thank you.